evening to our viewers. It has been said that you can live life two ways. One, as if nothing can be a miracle, and the other one is everything can be a miracle. Few experiences in life make you really have a perspective like this. Cancer is one of them. On this World Cancer Day, it's very important to understand and be aware about cancer and what it is about its financial implication. On that note, I take this opportunity to welcome the eminent doctor, Dr. Sanjay B. Dudhat. He is MS Consultant Surgical Oncologist, Head of Department Oncosurgery at Nanavati Hospital, Mumbai. Dr. Dudhat has a work experience spanning into last 27 years, and he has actually put his hand into a lot of surgical cases in various types of cancer. However, his specialty lies in the area of breast, gastrointestinal, and the gynecological cancers. So, on that note, Dr. Dudhat, I once again welcome you. You also have written in a lot of national and international magazines.
Right.
You have created 400 audio visuals for cancer awareness and cancer detection, and that talks volume. We would really look forward to an interaction whereby we understand this category of disease a little better in a very simplified way, and more importantly understand what we could do as a layman to keep this thing under control and well checked.
Right.
So on that note, sir, if you may allow, I would take ahead all the questions.
And thank you for the kind words. Thank you very much.
It's indeed a pleasure to have you with us again. So the first question that we have with us is the very basic one, which is, what is cancer?
See, the word cancer itself is quite the people afraid of. But whenever I talk to the people, you are afraid of this word cancer. So what do you mean by this? So out of 100, more than 90% people doesn't know what is cancer, the exact definition. Then I ask them, why you want to afraid of this word when you don't know what is cancer? So cancer is not because of any bacteria or anything. Cancer is because of uncontrolled growth of a normal cells into abnormal because of some external impact on the body. So people should know this definition by heart, and they should know what is cancer first rather than getting afraid of this word. And why? Because that is why we need a proper awareness regarding not only cancer effects, but right from his definition of the cancer is very important.
Interesting. So what is the present status of cancer in the world?
As we know that 50 years back, the scenario was different. We hardly used to hear cancer cases in India. But if you look at the whole world, the cancer is steeply increasing now. Now, if you see the percentage globally, around 15 million cases, 1.5 crore new cases of cancer, new cancer cases are being seen every year, and out of which 85 lakhs die because of the same. Now compare with India. India is a developing country, coming up country. Our scenario is 18 lakhs new cases per year, out of which 10 lakhs die. The difference between the developing and developed country is the death from the cancers are more in developing countries than the developed countries. So we need to have still proper awareness, and the treatment should reach all parts of the country, because India has a problem of reaching this treatment all over the country, and that is why we have got a lot of deaths occurring in the cancer. Another thing, why we are getting a lot of deaths in our India, because majority, more than 75% cases are diagnosed in advanced stages of the disease, and that is why early stage detection is only 12.5% India till today. So how is going to match about? Naturally, it is going to have more problem with the death scenario. So these things we would like to get down, and that is why we are working for the same.
And I guess that's exactly why you have done a lot of awareness audio visuals.
Correct.
And the number is as high.
When I was entered the cancer field, then I realized I think not only treatment will suffice. What I would like to do as a contribution to my society and to my country is making awareness of this problem all over to all the people in a simplified way, so that they can understand the meaning out of it, and that is why they can detect the cancer symptoms and signs very early. That is how the aim of my doing as a passionately doing cancer awareness.
So that leads obviously to the next question. ये वर्ल्ड कैंसर डे क्या है, हम क्यों मनाते हैं, कारण क्या है इसके पीछे?
The reason is like this. The World Cancer Day actually started celebrating since 2008 by the WHO directions. Now the UICC, that is United International Cancer Control, has done this needful since 30 years back, and it has been celebrated every year. Now they thought that cancer is increasing and deaths of the cancer are also increasing quite rapidly in developing countries and developed countries too. So how can we get this down? And all the things, all meetings had during that time, and they found this 4th February as a World Cancer Day, and on that every year there will be a nice theme for World Cancer Day. Now in this year we have a theme of I am and I will. That means I can do and I will get it done. So this is how the theme, to make the people more sound, more aware about the cancer, and make them brave to face the cancer if they have, and face the treatment what it has been executing. And that is why the aim of the World Cancer Day is to make awareness of a cancer, get the treatment to the people, and thereby reducing cancer deaths as much as possible.
So, doctor, you have been practicing for the last 27 years. You yourself mentioned that the cancer rates have really gone up. In fact, death के scenario भी जो आप elaborate कर रहे थे, काफी हद तक वो बढ़ चुका है. So, what do you think? What would be the reasons for such sudden increase in cancer cases in a country like India?
Very nice question. आप देखिए, आप 40 साल पीछे जाइए and go to the peripheral parts of India rather than metros, and आप realize हो जाएंगे कि अपनी जीवन शैली कितनी बदल गई है. If you look at 40 years back and now, there is a great difference between the lifestyle what it was there on 40 years back and now. It is not only lifestyle which is important, but rapid urbanization which is happening for last 30 years, 3 decades. Industrializations, as I said, rapid जीवन शैली आपकी जो बदल रही है वो तो one of the factor है ही. But in addition to this, the lot of addictions people have, like bad habits like tobacco, alcohol, smoking, so on and so forth. These are also attracting cancers because of their side effect and what the poisonous content of the tobacco as well as the alcohol. Then there are certain genetic origins for the cancers because of the हमारा जो वातावरण है काफ़ी दूषित है. So atmosphere which is polluted, that also affects the body. Then we are not doing any exercises. We are working like a sedentary lifestyle. So these are all the things get into action, and somewhere cancer is multifactorial. That is not a one cause. So there are so many multifactorial things. Increasing population also is one of the reason for increased incidence, and not only that, आयुर मर्यादा जो बढ़ रही है, increasing lifespan, अपना increasing अभी average lifespan is coming up to 71 in next few years time, but that is also because increasing age, by having older age group, immunocompromised status, and development of cancer, that is an indirect link. So these are all multifactorial things which cancer may be produced in the body. And that is why we need to look at all these things very carefully. We need to address this to everybody, right from students to elderly people, what we can do best to avoid or to change bad lifestyle.
So, since you spoke about change in the lifestyle, you also spoke about a change in the genetic conditions. Does cancer affect all parts of our body?
Yes. People say, are there only few cancers? No, it can affect right from head to toe. Any of the body parts you can have cancer in the body. Depends upon what type of damage the body has got from the external impact.
Okay.
So a cancer can occur any part of the body.
And what could be the causes of cancer? Though I know it's a repeat question.
As I said, it is not a unifactorial, it is a multifactorial thing, as I told you. And apart from your industrialization and rapid urbanization, I would always stress a bad lifestyle, stressful lifestyle, what we have got right now. Then coming to chemical pesticide exposures, radiation exposures, so many which we are having with a polluted atmosphere, with food adultery. I will make it a point on this specific word. We have a lot of adultery in the food also. We don't know what are the effects on the body which is occurring because of that. So all these things coming into actions will have a joint reflection of all these things, poisonous substances on the body causing cancer like things.
So sir, would you spend some time on a very common cause of cancer that we have heard about, which is tobacco?
Yeah, tobacco is one of the important causative factor as a bad habits. Now why tobacco is bad? Tobacco contains more than 3000 chemicals, out of which 100 are so bad it will cause almost more than 95% cancer in the body. You know nicotine, which is there in the it is a central nervous system stimulator, which you get addiction because of that. Tobacco specific nitrosamines, then lead, arsenic, and so many other poisonous substances are there in the tobacco which can cause cancer in the body. We have got a lot of problems with the tobacco. We got tobacco in India around 1756 by Portuguese, and it grown like anything. You can see the today's picture. Despite of banning gutka and everything, did not work out. And now what we are aiming at, almost 40% of cancers are caused by tobacco and its products. So if you stop tobacco completely, all the people in our country, we are going to eradicate almost 40% of the cancers which are occurring because of the tobacco. I think it is a pretty high percentage, and that is why anti-tobacco awareness has to be given to the people, what it causes and what it causes harmful things in the body.
So you spoke about awareness. Now tobacco awareness, there was a time when we used to do it for people who were in the age group of say 35, 37 or maybe a plus.
Correct.
Do you feel the need of doing this consultation even for a college goer or maybe even a school goer for that matter?
Very good question. That's what we thought, ki what type of cancer awareness and anti-tobacco awareness college student have. I would always say your awareness should start from the youngsters, because they are going to be the future Nagrik of this country, no question about it. They are going to do better for the country. So why not to make them proper, make their lifestyle proper by giving them awareness, because they are unaware that tobacco will cause this XYZ side effects. So we did our hospital did a small study with the colleges. I think 600 students responded very well for the questionnaire which we made. And what we got analysis from there, it is for a general cancer, they are quite having fair knowledge about it. But the subtype of cancer like oral cancer, cervical cancer, breast cancer, and their causes of cancer, specifically in cervix, multiple sexual partners can cause cervical cancer, or in breast there are certain factors which gives rise to cancer. These college students are not aware about it. They were aware about little bit of tobacco, but other things they were not aware. I think this awareness should go in all youngsters. It should start from the colleges. It should be such a strong way that you can stop all the bad habits right from their beginning of their career, and they will understand the importance of what is health and how it is health is wealth. So that's what we would like to bang upon them all the time. You have to do awareness not once. You have to do awareness of persistence, pursuance which is required, because these things are not going to change in 1 month or 2 months. If you want to do something good, you have to work for months and years together on this, and then the generation will realize what we are doing wrong.
You spoke about lifestyle. It's so easy to say that lifestyle is primarily responsible for
Correct.
anything that goes wrong in our life.
Cancer is a lifestyle disease, madam.
So if you could elaborate a little more, what change in lifestyle has actually resulted in sudden increase of cancer in the current society?
That is why I always tell the people, now in Mumbai, is there a need for marathon in Mumbai? For health point of view, it's perfectly fine, because everybody is running all the time right from 5 o'clock in the 11 o'clock in the night. Now why they are running, majority people doesn't know, and what they are going to achieve also they don't know. But what happens when you are doing this running, you are getting exhausted with all sorts of stress and what you are not having or not. Now how many people will cope up this stress? The importance is A, B and C person is there. A might cope up, B may, or C may not cope up. Then C person will suffer from all other diseases, not why only cancer. He will suffer from diabetes, he will suffer from hypertension, he will suffer from any chronic illnesses. So person should retrospectively analyze their selves, what they can able to do and what they can do. That is most important. We are just running for the same. Ambition should be there, but ambition should be at the level what you can able to execute yourself as an individual person. That's more important according to me. Career oriented life, I do understand. Majority people are doing very good career, especially females, doing very good job. They are doing multitask job, hats off to them. But if one lady asks me, doctor, I want to prevent breast cancer, what I should do, what I should follow in my life. So there are certain things which need to follow. That first, pregnancy before age of 30 will give progesterone coverage, so that it can help to prevent the breast cancer. And if there is a delivery, breastfeeding has to be done at least for 1 year, which can decrease the chance of breast cancer more than 30%. So these things, for example, but things are not working, because with a career, marriages are not happening early, pregnancies are not happening early, so they are going beyond 30s, and that is why we are land up in the bad tissue. Now what is happening in India, the cancer scenario is changing in last decade. We are getting lot of young cancers now, less than 40. It was less than, initially was above 60, then came above 50, now it is above 40, now it is less, above 30 and above 20. Now we are seeing a lot of younger patients between the group of 22 to 40, which is increasing steadily. Of course 20 to 30 is not too high percentage, but it is coming, which was not there 20 years before. Now this scenario of young cancers, we did not like it, because it needs to be addressed properly, because they have got a very aggressive cancer biology and they are very aggressive cancers, not easy to treat. So we need to address this issue, why suddenly young cancers are occurring, what is the mutation genetic occurring at that particular age, in a younger age. So there has to be some sort of study or research has to be done on this, and it has to be addressed. Now the recently diagnosed 26-year-old female with a breast cancer asked me, why me doctor at the age of 26? What am I going to answer to her? She was having genetic predisposition also, she was triple negative. So these things need to be addressed properly. We don't find good young patients which are suffering. Now this Asian country and India having exactly reverse than the Western overall scenario, we are getting more and more younger patients. Now this scenario is going to change and more in 2030 and 2050. So we are going to see more and more younger patients if this overall things are not managed and not stopped.
Doctor, I have a question. Since you mentioned a very specific case of a 26-year-old lady reporting about breast cancer, of course she carried certain genes, but as a recommendation, what could have been a preventive approach for this lady who is so young? Can she preempt? Can she start?
It is very difficult to prevent, because we don't know the cause of this at the age of 26, why it is happening. Now if the lady has got hereditary predisposition in her, suppose her mother was having a breast cancer, then we can understand it is a hereditary coming down. But if there are no hereditary, suddenly you are getting the cancer at the age of 26, very difficult to make out the cause at present era. But at least genetic counseling we can do, and for that genetic counseling, after doing the genetic counseling, at least we can decide the line of management. Suppose if you take this scenario in a hereditary issues, so mother is having breast cancer, so and the daughter will definitely ask, will I get the breast cancer? So you need to do genetic testing. Now these BRCA1 and BRCA2 mutations are found. for breast and ovarian cancer nowadays in 10 to 15%, but percentage is not very high, but it is around 10 to 15% cases. Now this, what we need to do, we need to find out these high risk individuals and then study them properly with genetic profile, and after that you can execute the treatment accordingly. Now mother is having suppose BRCA1 positive, then you have to do this BRCA1 testing for a daughter also at the same time, and if she BRCA1 positive, you need to monitor them and surveillance them properly till their childbearing age and everything, and later on we can do the surgeries which are risk reduction surgeries can be done, which will come in picture in India later on. At present there is no much of acceptance for that, I understand that, but it will come in future. But genetic counseling, everybody should know about it, and it is going to come in a bigger and bigger way.
So before we take up our next question sent by one of our viewers, I just thought of asking a quick question related to this is, you spoke about so many things which are available.
Correct.
But is it available across every corner of India, or is it kind of...
No, genetic testing is more of in metros right now. Unfortunately, cost is little on the higher side, but the cost which was there 5 years back, it has drastically come down by almost 70% down. But still, what is the cost right now? A very common man cannot afford that, I can understand. And in peripheral areas, they can't even afford mammography, forget about the genetic testing. So if you look at the scenario of India, how many patients are getting treated is 40%. 60% they are not aware, they are not financially sound, or treatment doesn't reach to them. That is how the scenario in India. And I think, of course, everybody is working, government is working on that, people are working on that, social NGOs working on that, to how we can give help to these cancer patients, no question about it. In fact, we always request to help this patient so that many cancer patients get treated, because they have a right to live, no question about it.
So is there any NGO who kind of supports all these causes?
Yeah, there are a lot of NGOs which are working, metros in peripheral areas also, they do help. Nowadays there are insurances also which are coming up, medical insurances. Now medical insurances, the knowledge for medical insurances is very less nowadays, but only thing, whosoever can afford, they can go for medical insurance, at least some part of thing will be covered for them. And if people are not able to afford taking medical insurance, if they are that poor, then NGOs are there are trusts which are there are certain donors which are there for cancer patients which can able to, only thing we need to find out for them. Because some people are so poor, they don't know how to get out, come out, and how to meet those people. I mean, for them, I feel very pity. I think such people need a real help, and we need to find out who are the real genuine people. That's what I feel. Always.
We will continue on the topic of, having a self-cover through insurance. In the meanwhile, we have one of our viewer asking us a question. So Gaurav is asking, is it rare for a stage 4 cancer patient to really beat a cancer? Let's hear it out from you, doctor.
Unfortunately, the answer is no, because stage 4 is the last stages of cancer where the cancer spreads all over the body. Now you can beat the cancer in first 2 stages, that is stage 1 and stage 2. Almost 97% cancers are curable. In stage 3, around 25% with aggressive treatment we can cure it. But stage 3 75%, and stage 4 they are under control or under palliative measures. Very difficult to give cure because the cancer is already spread. Majority patients in India, they come with spread in the body. So it becomes very difficult for any medical forum to control the disease and to give cure to them. So there are certain treatments available like chemotherapy, targeted therapy, which will prolong their life, which will prolong disease-free survival as much as possible and make them at least fairly give quality of life. In cancer treatment, remember, the main 2 words which is important is quality of life. Now, if you can't give quality of life, then there is no point in giving any treatment. Your patient should receive treatment with fairly having good quality of life.
So on that note, we have a next question which has also come to us from Aneri. Why did you choose oncology as your career? That's
very good question. So initially I came in contact with few patients initially, and after my MS general surgery, I thought of going to this cancer. During when I joined Tata Memorial Hospital, one of the finest hospital for cancer in the world according to me. I got great respect to this institution, no question about it. And this Tata Memorial Institution, when I went there for the first time before I joined, just to see, and I thought of so many cancer patients at once because it was a tertiary referral center, and I saw the agony of the people, and then I went in and in. I got into Tata Memorial Hospital and I started loving and serving these patients much better. Then I thought, wow, how can we do better for these patients and get this agony out? That time oncology was in a very primitive way. It was just in a emerging phase in India, 92 onwards I am talking about. But later on it has picked up so well, excellent treatments which are available, and I don't repent that I have taken oncology. I am very happy that I could able to give much better quality of life to my all patients, and I did best, one of the best on my capacity to my all patients.
On that note, I must share over here that Dr. Sanjay has been felicitated with lots of rewards and recognition, one of which has been for helping the economically challenged medical students at Sion Hospital. Speak volume about you. And continuing on that topic, Dr. Sanjay, is the next question, which is, there are a lot of myths which exist about cancer. So say for example, mobile phones and cancer. Do you really see any association? क्या सच्चे में फर्क पड़ता है?
Presently, if you ask me, अगर मुझे पता कि मोबाइल से कैंसर होता है कि नहीं, presently our answer is no, because we don't have a concrete answer on this. But whatever the research which has come from United Kingdom and United States, basically what they say, if you use this instrument a longer time for some years, then some bad effects will occur on the brain and the head, especially on the head and neck area. But my suggestion is that why to wait till you get the wrong results? So use the mobile or the instrument judiciously. It should not be used very casually, because mobile should be used as an emergency purpose, not to talk for hours together. Because mobiles is a very touchy thing, I do understand, everybody is on the mobile. And not only, why you talk about cancer, because they say there is a good chance of brain tumors after some years, some researchers says. Of course, we don't have right now concrete study on that at present as a present data. But other side effects of mobile you can see. People stop reading with the mobile. There are so many things they are getting attracted toward mobile, and their creativity is going down. There are so many other side effects they are talking about, that deafness, they are talking about memory loss. There are so many things, people coming out with the small things about the mobiles. And I believe you should not be dependent upon one gadget for a long time. I think we are all good human beings with a good creativity, and we should not lose creativity. Creativity should not come from mobile. Creativity should come from you to mobile. That's what I feel always.
So reiteration leads to perfection. A lot of people have been telling this to us, but yes, coming from you makes all the more important for all of us.
I would always tell all the people, be careful all about these gadgets. Sometimes what they will do we don't know, but be careful and use very judiciously, not as a fashion or fancy.
Absolutely. And comes the next question from a viewer, which is, why do they call certain cancers a good cancer? Interesting. Meera, that's from you.
Very good question. See, good cancers means whenever you treat these cancers, the patients are cure rates are very high, and they live for a very long life. Say for example, thyroid cancers. Well differentiated thyroid cancers are very good cancers, and if they detect almost in, of course, all cancer has to detect in stage 1, stage 2, then they are good cancers. Even stage 1 breast cancer is a good cancer. Stage 1 colon cancer, large intestine cancer is a good cancer. They will do very good, they will have high cure rates, they will live longer. That is why we would always say, what is a अच्छा गुरु के लिए कौन सा है कैंसर क्योर करने के लिए? तो उसका प्राथमिक अवस्था में होने वाला रोग निदान. Key to cure cancer is detect cancer at the earliest phase. So you will get all cancers which are good. You will say all cancers are, treat cancer as other disease. Don't give cancer as a hype. Don't treat cancer as a different disease. Treat cancer as the another diseases which have got a treatment. Be alert and change your lifestyle, change yourself, and see that how you become a better and better person with the health in future.
सो सर, क्योंकि हम लाइफस्टाइल के बारे में काफ़ी बार बात कर रहे हैं, तो अगला सवाल जो नेचुरली आता है कि खाने के साथ कैंसर का कुछ कोरिलेशन है? ये जो फास्ट फूड है, और अक्सर हम लोगों को कहा जाता है कि बाहर का खाना, फास्ट फूड इज़ नॉट गुड, डज इट हैव एनी कोरिलेशन?
बहुत ही अच्छा और टची क्वेश्चन है आजकल, बिकॉज खाना खाना है इंडिया का एक गुणधर्म है और बहुत ही डिलीशियस फूड पीपल लव टू ईट. नाउ व्हाट हैपन्स इज food bad? Now listen, now bad food is what? It contains lot of oil, lot of fat and other substances which are harmful. Now take an example of fatty things. When you are eating lot of fats for the body, your fat and body mass index goes bigger and bigger, and this obesity, when you get into obesity proper, obesity is now considered as a disease, and they have got a correlation found. There are so many cancers are occurring because of obesity. If you take an example, breast, ovary, large intestine, kidney, esophagus, that is food pipe, then pancreas, all these cancers are related directly with the obesity. The percentage of this cancer, they are high in the obesity. Now if you look at endometrial cancer, now they are more occurring in a postmenopausal age group. Now what is happening in obese females? This fat is getting converted into estrogen, and cancer endometrium is a estrogen dependent cancer, and that is why this percentage of cancers are increasing. So obesity, so it is directly related to food only. So food is not directly causing cancer, but it is causing indirectly by increasing fat in the body. Another thing, there are certain food adultery which is going on at some places, and that food adultery, what substances they are putting, we really don't know. What is going effect on the body? Any harmful things if you are going to it, body is going to react to the situation. Now it may react as a cancer, or it may react to any other diseases. So you have to eat good nutritious food which is well cooked, not the preserved food.
So food adultery is something which is coming time and again, and in a country like India, would you like to share a couple of instances where it has happened and maybe government has taken some steps to stop it?
No, FDA is working on that very well. They are stopping whenever it is occurring. There is no question about it. But I would rather say people should realize what to eat and what not to eat. Why you want to eat all the time food outside? You have got a really good home food. You can do so many food at home, items at home. Why not to eat home food? Why you want to go all the time outside every day in and day out? So you have to control yourself. You have to give lesson to yourself that I will do best for my body. That is how it should be. It is very difficult to teach everyone not to do this and do this, but at least everybody should teach themselves. I think that is what is called as retrospective analysis to keep your good health. I think that is more important, rather than if something is banned, it doesn't work, but you can stop going there, it can work. That is how it should be.
Self-control.
So people should be told which is good and which is bad.
Sure. There's a next question on the screen from Bharti, which says that, do you know anyone who rejected chemotherapy and tried to manage his or her cancer with natural therapies only? If so, what ingredients, methods did he or she use, and what were the results around it?
Unfortunately, this question I cannot answer effectively because I don't have study on the natural therapy on the cancer, number one. Number two is, some people are very reluctant for chemotherapy. They are literally frightened about the chemotherapy, and that is why they go to natural therapies. But when they go to natural therapy, our contact with them is lost. Majority time we don't know what is happening to them because we don't have follow up, because they go and come after 2 years with advanced disease. So we don't know about what has happened in between the period. So it's very difficult from me to comment on this, that other therapies works or not. I don't have study on that.
Doctor, is it possible that in case somebody is detected with cancer and other people are in close proximity, he or she will also pick up cancer from them? In one word,
so one thing is a very nice question. I would like to still answer this when we are in such an educated era of we are in 2000 plus, so 2020 now. So cancer is contagious, still it is there in educated people. I feel very sad when the person is there with the cancer, they ask whether it will cause problem to my son or somebody. No, it should not be like. That's why I said, no, cancer awareness is very important. Cancer is not contagious at all. you can eat in the thali of a cancer patient, nothing will happen to you. That people should know it. Treat them with respect. Don't treat them with a stigma in the society. What cancer patient doesn't like is pointing towards them. So treat them with a great respect. Nothing will happen to anybody in the family or outside with their contact. I am telling you, assure you about it.
So true. And that brings to the next question on the screen, which we have from Vandita. How many days in general will someone survive in case somebody is detected with stage 4 cancer?
It depends upon what type of cancer it is. Suppose if it is a breast cancer, in a stage 4 also, there are so many good therapies are available, and breast cancer is a responsive cancer for the therapies. People can go on with the stage 4 for 5 years, 6 years, 7 years also. Now, lady with the bone metastasis only, which has gone into the bones, we have made survival up to 7 years also. But if it goes to the liver or lung very badly, sometimes you get a constraint, but still you can fight with breast cancer, you can fight with ovarian cancers, we can fight with large intestine cancer, which are very favorable cancer. But if you talk about lung cancer, if you talk about liver cancer, if you talk about gallbladder cancer and pancreatic cancer, they are very aggressive cancers. In that stage 4 cancer, to have a survival for long years becomes very difficult despite of good therapies which are available. But that is why favorable and these non-favorable means they are very aggressive type of cancer. So in that context, doctors has got a limitation to increase their survival as much as possible. But that depends upon what type of cancer you are having. Suppose prostate cancer, very slow growing cancer. If you have got a multiple mets also, people will live for a longer time. So that is how it depends upon the type of cancer.
So doctor, you have been associated in this field for the last 27 years. There
Right.
has been immense technological improvement. So do you think the chances of survival which was there 27 years back versus right now at a stage 4, it has seen some amount of positive
It
change?
has overall, forget about stage 4, you can tell about overall survival of cancer is increasing, and especially these cancers which are, as I told you, breast, ovary, large intestine, kidney, then for that matter oral cancers also some. So in an early phase, if you detect, the survival is much better. Again, there is the same thing I am going to repeat, the cancer has to be detected in early phase. In a era of today, even if you have great therapies and if your cancer is stage 4, you are going to have some hindrances, but your cancer detects in stage 1 disease, excellent survival, excellent thing. I am telling you, we have got so many number of patients who has got done such a good work after cancer treatment. They have got state awards, national awards, they are flourishing outside in their own field also. It's not like that after cancer treatment they are finished. No, it is a very wrong, it is a myth in the society that once cancer occurs they cannot do anything. People are doing wonders after the cancers.
And you know, I'm sure there are a lot of celebrity examples which endorses what doctor told right now. And in a normal life, we do come across so many people who have been able to change their course of life after the treatment. Vandita, hope that answers your question. And the next question that we have is, ये जो cancer है, माना जाता है अगर मेरे को है, तो it will go through my genes to my next generation and keep on passing, maybe creating a negative legacy. क्या ये सच है?
See, these are the hereditary cancers basically, that is called as cancer, karkarog, anuvanshikata. Now, how many cancers are hereditary? As I said, breast cancer, ovarian cancer, endometrial cancer, lung cancer partly, large intestine, kidney cancers, these cancers are showing hereditary element. Now, how much hereditary element? Is around 10 to 15%. I have seen kidney cancers in the family. So, father is having and 2 sons are having kidney cancer, which is there in the family, and we treated full family with the same, with the operations also, and we have saved the kidneys by doing partial nephrectomies. So this can also happen. In breast cancer, we have seen mother and daughter suffering with both cancers, and we treated with them, and that is why this genetic counseling is going to do wonders in future to find out genetic mutations, and whatever the study will do in future, it's going to help us to study about more of this cancer and how can we monitor them and how can we treat them and can we prevent them by any chance it is possible. Right now, prevention of the genetic cancer is not possible right now. Only thing what we can do to detect them early, which we will able to do, but prevention, I think later on studies will able to tell us in the genetic profiling what can we do in the genes itself.
Prevention is better than cure, and genetic counseling, the word itself is coming time and again. डॉक्टर प्लीज हेल्प अस अंडरस्टैंड ये जेनेटिक काउंसलिंग क्या होता है, कौन करवाते हैं, कहाँ पे ये सुविधाएं मिलते हैं, कहाँ हम जा
Genetic
सकते हैं?
counseling, these are the available for certain cancers, for example like breast cancer, ovarian cancer, pancreatic cancer, BRCA1 and BRCA2, breast cancer gene 1 and breast cancer gene 2. These two mutations which are occurring in some patients, which are in hereditary also. Now these testing which are available at many places of metro nowadays, they are available with some cost. I do understand for a very common man this cost is little more, I do understand, but some people can afford this, because initially when they came they were with a very high price, but nowadays it is in a quite affordable price which some people can afford and they can take the advantage and benefit out of it. But I still feel the price needs to come down in future as much as possible, so that it will be used by the multiple people, multiple cases we can able to study on that, and it will help us this study for the futuristic things also at the same time. But these things are important, people should know about it, because only metros knows, peripheral area doesn't know about it. I think this knowledge should go to them also later on.
You have been speaking about the cost part of it. Would you like to also give some glimpses कि कितना हो सकता है खर्चा ये genetic counseling के लिए?
Genetic counseling is basically what type of test you are having. I cannot quote one test, but around BRCA1, BRCA testing around 15 to 20,000 rupees, which are available in majority of the places now. Initially they were very high, but these are the common reasonable prices they have come up to. I think it will still reduce in future, but I think some people can afford this and they take the advantage out of it.
तो क्या ये एक टेस्ट से ही काम हो जाता है कि मल्टीपल टेस्ट करना
No,
चाहिए?
this is, we are doing it for genetic predisposition to find out. There is another thing which is called as genetic profiling for the cancer treatment point of view. That is
a separate
complete
costing
separate
area.
cost. That is a higher costing, because
Yeah.
on that genetic profiling you are going to decide about the treatment, immunotherapy and everything about it. So that is a different genetic profiling as a cancer treatment point of view. This is for the genetic abnormality which you are going to find in the individual as a hereditary.
So doctor, maybe we'll just take a pause because there's a question which has come from Abhishek, and he's asking, can one offset the effects of smoking through lifestyle changes to reduce the chances of getting cancer?
I have understood this question. Can one offset the effects of smoking through lifestyle changes to reduce the chances? Effects of smoking.
Effects of
Stopping smoking.
stopping smoke.
Yes,
and then
I think we would always say that tobacco and smoking has to be stopped on the spot. It doesn't stop gradually at all, and if stopping smoking of tobacco is 10,000 times beneficial, I am telling you, to the body. It rejuvenates your body. Once you stop smoking, you will see the changes in your blood pressure, blood flow within 20 minutes of stopping the tobacco, 1 hour, 1 day, 1 month, 1 year and 10 years. This is how they are going to give the all benefits because of reducing the lung cancers, reducing other cancers, reducing your heart attacks, cardiac problem which is occurring, paralysis which is occurring with the smoking and tobacco. All these things will reduce. It will improve your quality of life, sir. So if at all somebody is smoking and tobacco, my humble request on this venue which I am talking, please stop that on the spot. I am telling you, you will be 100% benefited.
You yourself mentioned that over a period of time we are realizing that school में जो बच्चे जाते हैं, the tobacco consumption over a period of time
Yes.
is increasing at school. I mean, how alarming is that? Any piece of advice and suggestions?
So if
for
you look
other
at the
children
tobacco
out there?
statistics, around 1 to 1.5 lakh new children develop this habit in India every day and every year.
Oh,
This is how the stat says. So if at all having 1.5 lakh children having this habit every year, which is quite big number in India. So this is how we need to give them education. I think teachers and parents, I think, should play a major role in this, and health workers which are there in the periphery as well as in metros. So I think we need to very clear about this issue, that these school children, I am telling you, school and college is the right way to do majority of samskar. We do all adhyatmic samskar, but health samskar, according to me, should be done right from their childhood, which will give them, I think, more wealth than anything else in their career.
so Abhishek, I hope you got your answer, and yes, so that was the last question we had on the screen. So we'll get back to the topic we were talking about is How many cancers do we detect early in India? You spoke about it, but once again, a little reinforced.
Yes, nowadays we are saying, of course, cancer detection rates are early detections are very low still today, but there are people who are coming with lump in the breast because it is palpable, you can feel it. So that is why we are propagating self breast examination also for the people, so who can able to see examine their own breast. Sometimes they don't do mammography, then it becomes very difficult to make out. Even if the lady comes with 2-3 centimeter tumor palpably, it is still treatable and curable. So that is why we are propagating breast self examination BSc to the people. So breast cancer is such a thing, you can able to detect thyroid cancer, which is seen superficially also in the neck. So you can make out the enlarged thyroid and go to the doctor. But what happens to us, we are so reluctant to go to for the test and the doctors, and there is a fear that somebody tell me that means there is a cancer. That's why ladies don't show their lump in the breast, and they come with a 12 centimeter lumps which are cancerous in the breast, which becomes very difficult to treat. So that is why our humble request, if you feel slightest, and again I am telling you, there are so many myths that I have got a pain in breast, then I have got a cancer, which is common female comes in our clinic which gives this complaint. But I am telling you, initial stages breast cancer, the symptom is painless lump in the breast. It is not a pain which is giving a cancer. Pain occurs in cancer in breast, which is in a very advanced stage of a disease. In early stage of a disease, you get only painless lump in the breast, and you have to pick up that. Even if you don't pick up early with the mammography, at least with the palpation, at least you can find out abnormal tissue. And always I tell you, you must able to love your body. Then only these things will happen. What is happening nowadays because of the changed lifestyle and career and what we are running around, we are abusing our body. I am putting a very benchmark statement. We are not looking after ourselves. How many people, 24 hours a day we work, not even 1 hour was given to the body for exercise, yoga, meditation, nothing. We don't have time. Now this answer is absolutely incorrect. It is not pardonable. So you need to have 1.5 hours of the body and at least 7 hours sleep. You have got others 14-15 hours work which is there, ample amount of time to work, and you have to smartly decide what you want to do. And that is what respecting your body. If you disrespect your body cells, they will start crying, and that cries become very difficult to stop. Always remember that how you require respect from the people and admire, body cells also requires that respect. So if you are eating wrong, खाने के लिए बहुत अच्छा लगता है, but अंदर जाने के बाद जो poison होता है, then the body starts, then you get acidity, you get all sorts of nonsense things out of it. So have eating times should be proper, exercise should be proper, give 1.5 hours to your body every day properly with exercise, everything. See that what change it will come in your day-to-day activities.
You have been talking a lot about breast cancer, detection of bulb, some self-tests. So, एक बार जब detect होता है first level पे, what is the next follow-up course of action?
See, suppose if you take an example of a breast cancer, if you get a lump in the breast, lady comes to a doctor, I have got a lump, मुझे गांठ लग रही है, तो क्या कर? पहले हम स्टेप करते हैं मैमोग्राफी का, बोथ द ब्रेस्ट का मैमोग्राफी और सोनोग्राफी ऑफ द ब्रेस्ट करते हैं. अभी डिफरेंस क्या है? मैमोग्राफी इज अ एक्सरे ऑफ द ब्रेस्ट एंड सोनोग्राफी इज अ सोनोग्राफी ऑफ द ब्रेस्ट. दोनों साथ में क्यों करना चाहिए? जो मैमोग्राफी में दिखता है वो सोनोग्राफी में दिखता नहीं, जो सोनोग्राफी में दिखता है समटाइम्स मैमोग्राफी कैनॉट शो, सो दे आर टुगेदर. So mammography with sonomammography, this is the first thing we do it in the breast lump patient. Then we grade the patient ki whether it is suspicious of cancer or it is benign or non-cancerous. Whatever is there, if the 45-year-old lady with a 2 centimeter or 3 centimeter of lump which is irregular, which is suspicious of, we subject them for a biopsy. Okay. We don't do open biopsy. They are good truncate biopsy, sonography guided, which are available on the OPD basis. It is been done straight away on the OPD. 10 minutes it takes, and you send this, because why it is important? It gives you core of the tissue. The core of the tissue rather than doing fine needle aspiration. I think we always do core biopsy to get a more accurate diagnosis. And once you prove that it is a cancer, then our staging of the cancer starts. Once we stage the cancer, it is operable, then we operate the patient. And after operation, we see the histopathology report in detail. And then we give them a additional line of treatment to cure more for the patient. That is how the algorithm goes for cancer treatment.
That is what the steps are all about. So doctor, yes, we have another viewer who is asking a question to us, Shashank. Which is the best hospital for cancer treatment? Since he has not mentioned any specific
Your
location.
question is good as a layman, but it is very difficult to answer from my side. I'll tell you, there are so many hospitals are doing very good job. The main hospital in India is what? Is a Tata Memorial Hospital, which is a tertiary center. But is one hospital is suffice in India with 136 crore population? No, not at all. So it has been divided in so many hospitals all over the country, all over the metros, all over the small cities also, and they are doing very good job, and they are getting lot of advancement in the hospital too. So which is the best? It's very difficult to tell. Majority hospitals are doing very good job, and they want to execute better treatment for the people.
Okay. The next question that we have is, what are the screening measures which are available to detect cancer?
Excellent question. People always tell, Dr. Dudhat, you have told us about detect cancer early. So how we detect the cancer early? So there are certain screening tests which are available for certain common cancers. So say take an example of females. Now breast cancer, we have got a mammography and sonomammography. It should start at the age of 40. So for breast cancer, what are the screening we do is breast self examination we teach from the age of 20. Okay? And then mammography from the age of 40 onwards every year till age of 75, which we are doing it now. Another thing is that if the lady is high risk, has got a hereditary predisposition, she might start this mammography at the age of 35 also. But everything has to be done under the guidance of an oncologist. Don't do self investigation, because interpretation, if you don't understand, you will miss out on the cancer. Please remember this word: no self investigation, no self mammography or sonomammography. Then for cervical cancer, we have got a pap smear. It is normally done after the age of 30 or a pregnancy after marriage, but ideally it should be done, if you want to do it very accurately, after first sexual exposure. You start doing pap smear later on. That is how the pap smear starts, but normally they start after the marriage and after first pregnancy. Every year they do. That is for cervical cancer, because cervical cancer is sexually transmitted human papilloma virus, majority around 70 to 80%. Now sonography pelvis is not a national guideline, but as a non-invasive method can be done, but it is not an international guideline. Now in the males, what we have in males for oral cancer, for oral cavity examination, ideally one should do oral cavity examination everybody. Forget about a person is smoker or a non-smoker, but they are smoker, then proper oral cavity examination in thorough details, visiting to the dentist every 6 monthly. Then if they are smoker, heavy smokers, then they have to undergo chest X-ray every day to see their lungs, because lung cancer is very common in the smokers. And in prostate cancer point of view, we start doing PSA, that is prostate specific antigen study, from the age of 60 onward, because prostate cancer we never used to see before age of 75, 25 years back. Now we are seeing in the younger age group up to 60, 55 also. See, we started this screening around from the age of 60. So these are the screening methods. Unfortunately, every cancer, ovarian cancer doesn't have screening modality. Unfortunately, certain cancers do have. So you have to be vigilant enough for your symptoms. What I suggest, vigilant for your symptoms. If you have got a chronic cough, don't wait for 3 months and don't go to the doctor. It may not be a cancer, it may be tuberculosis. It is there in still India. It may be chronic bronchitis, which is well treatable. So be alert what your symptoms and approach to the doctor. There are so many good doctors available. Why only metros? In peripheral areas also, that good doctors are there. There are good centers are coming up in small areas also. So take the advantage of everything.
Okay. Since you spoke about ovarian cancer not having any early, early screening process. So what could be the early symptoms that somebody?
See, unfortunately, ovary we are lacking in screening modalities because they are vague symptoms. Okay. Because with such a big tummy, and if you have got a small ovarian tumor of 5 centimeter, how are you going to feel any symptoms? There are no symptoms. Symptom comes once they goes in stage 3 and stage 4 disease, and that is why ovarian cancer all over the world in diagnosed, almost 75% patients are diagnosed in stage 3 and stage 4 disease, because lack of accurate symptoms, vague signs, and no screening modality.
And what are the chances of survival or getting cured?
Now majority patients in ovary we are getting only stage 3 only. So we are pulling on with the aggressive chemotherapy, because chemotherapy is doing wonders in ovarian cancer nowadays, because they are shrinking the tumor, so we can able to operate these tumors now. Otherwise, stage 3 tumors sometimes you cannot operate. So you give the chemotherapy, shrink the tumors and then operate. And then this survival with aggressive treatment, addition of targeted therapy has improved survival further, but you require time to time chemotherapy, time to time treatment to increase and prolong the survival, because we are getting the disease in higher stage of the cancer.
Okay. So few have got a screening process, few do not, but what remains important is we need to be aware and at the earliest symptom visit the doctor for a proper consultation.
Correct, most important.
And that takes us to the next question coming from Bharti. What are the effects of cancer once it is cured?
No madam, no effects of cancer at all. I am telling you, people are worried about the cancer treatment effects which are going to remain for a longer time. Not at all. If you do surgery for breast cancer, there are no surgical side effects after that, no question. We are preserving 65% of the patient, we are preserving breast in breast cancers. And if you are doing a mastectomy, we are offering breast reconstruction also for them. So having better quality of life. Number 3 is chemotherapy. Chemotherapy, even if there are certain side effects, they are remaining for only for the treatment point of view. After the treatment, no side effects remains inside the body. Even if there is hair loss with the chemotherapy, hair comes back in a much better way which were there before. So even if radiation therapy is given to some areas, they don't have side effects for a longer time, they persist for few months and they subside. So no, even if you treated cancer with a long treatment of 7 or 8 months, after 6 months of time, all side effect goes and he or she can work like a normal individual, no question about it.
So doctor, you are an alumni of TMH, which is Tata Memorial Hospital.
Yes.
You have spent 27 years into this field, and I'm sure you have witnessed some of the major technological changes that has come into this particular domain. So would you like to highlight few such technical advancement which has come as far as cancer treatments are concerned?
See, right from advances in radiology also, we have got MRI mammography apart from mammography. MRI mammography, we can do it in selected patients. We have got a PET scan. Now PET scan is what? PET scan is a radioisotope study along with the CT scan. Now why it is important? When it came in the picture, everybody thought it is a cancer diagnostic tool. It is not a diagnostic tool, it is a staging tool. Always remember, it is useful for when cancer is diagnosed, what stage of the disease and where it has spread, the PET scan will be able to tell you the details. So that is why PET scan is not for a screening purpose, PET scan is for basically staging and monitoring purpose. Suppose if you are given a chemotherapy to the individual, what is the response? You can we do PET scan before chemotherapy and after chemotherapy. So PET scan is one of the best boon for our cancer treatment as a monitoring as well as staging of a disease. Our treatment might change after the PET scan is done, but PET scan when to do and which patient and which stage to do, it is very important. It should not be misused or it should not be used as a casual affair, because you are using radioisotope as well as radiation from the CT scan point of view. It should be given. Suppose if you have got a stage 1 breast cancer, you are not supposed to do PET scan for that unless there is a symptoms. But if it is a stage 3 breast cancer, yes, I would definitely go for a PET scan to see the spread of the disease. So these are the diagnostic some modalities. Then MRI also has got more and more 3 Tesla and other things are coming up. Then if you look at surgical evidences, now we have got a radical surgeries coming for a long time, 50 years back, since they thought cancer is a local disease, but then they thought with the researcher it is a systemic disease. Then why to do such a radical surgery? Why to remove organs? They came down to organ preservation technology. So last 25 years we are absolutely putting focus ourselves on the organ preservation technology and function preserve. See, for example, if the breast cancer 25 years back, every breast cancer we used to underwent mastectomy, that is removal of the breast. But if you preserve the breast in a lady, who wants breast to be removed? Nobody wants it. They do because there is no choice. But if you have the choice, one should take it. And always remember, breast preservation in a good selected cases, always put the patient in upright position in the society. So these are the surgical thing. Robotic surgery has come with a precision. Now if you see prostate cancer, it is excellently done by robotic surgery, because not that open surgery you cannot do, but robotic surgery has got a precision to do it. and the side effect of that risk of surgery minimizes quite a lot. So, there are certain uro-oncology, lot of things are happening with the robotic surgery. So, there are laser surgeries are also there in head and neck cancer, laryngeal cancer, there are certain cases which are doing, but they have got a selected cases which is very important. So, these are all. Then in chemotherapy we have got advanced drugs, we have got a targeted therapy, we have got a targeted therapy in the form of tablets, in the form of IV drugs, but they are doing wonders with the addition of chemotherapy. Of course, there are certain side effects, I do understand, but yes, they do good for even in stage 3, stage 4 disease, they help in improving, prolonging the survival as much as possible. Considering radiation therapy has got excellent machines now. New machines have come with a initial what you have LINAC accelerator. Above that, we have got a Halcyon and other things which are coming up, and these radiation machines, when they work, they have got a very side effects. They are focused but less side effects. That is why technology is a boon in oncology, no question, right from investigation to surgical and other treatment. So, technology take the help, but our again baseline remains early detection, do not forget that. So, it will be helpful for everyone, but try to remain alert yourself to help to get cancer detected at an early stage.
So, early detection and professional guidance from the right doctor is
Correct.
very
Very important.
And Meghna is here with us, and she is asking that if the next chemo day gets delayed by a week or so due to WBC count or maybe any other recovery reasons, will it really affect the prognosis? Which
Not at all, because chemotherapy can derange the WBC count because it is a bone marrow suppressant. Sometimes it is a side effect. So, even if the chemotherapy is prolonged for 3-4 days or 1 week also, it will not cause any impact on the prognosis or survival point of view at all, because finally remember madam, your body has to cope up with that. If we do not wait till the things come to normal, and if you give chemotherapy, you will become more miserable phase. You will try to catch infections, if WBC count will still go down. So, it is, let it leave it on the medical oncologist, whosoever is treating you, but it will not have any impact on your cancer cure or whatever is treatment is been indicated for.
मुझे आपसे ये बात पूछना है कि कीमोथेरेपी इतने बार अभी तक हम लोग बात कर चुके हैं, is it really painful?
See, one thing, chemotherapy, I don't know why people call it is painful. I don't understand. Painful is a wrong word. Okay. Chemotherapy has a side effect. Okay. Now, what is the major side effect people doesn't want is loss of hair. Unfortunately, we could not overcome in the world what to do about that. People tried right from cooling the hairs to everything. But what we suggest them, use a hair wig. There are certain good hair wig, natural are being made. Use hair wig, and after that, you will not able to looked by the people or pointed by the people that you have taken a chemotherapy or your baldness is there. So, that is number one. Whatever the side effects, now almost vomiting is unheard of, very less now, less than 1%. Nausea sometimes there, sometimes loose motion, sometimes constipation. There are certain side effects which are very well tolerable. Only thing that some weakness you get around first 7 days. I think what it needs, majority time what happens, I will tell you, the crux is majority cancer patients are half the time mentally are very weak, and they don't come with a strong positiveness for the treatment. And what happens, despite of less side effect also they feel that weakness is more. So, that is called as mental weakness and physical weakness. I think oncologists and psychologists has to do good job in all the patients according to me to get their physical and positiveness more and more for the treatment point of view.
Thank you so much for that point. And doctor, there has been so many advancement, there has been so many improvement, there are so many technological advancement, but yet there is no final solution to cancer yet. Why so?
Because the $1 billion research is going on the cancers. There are new findings which are coming up. Now, if you look at 100% cancer, if you take the chemotherapy options, 65% do respond, good, 25% do respond partially, 10 to 15% may not respond also. Now, why this is so? That is what is called as tumor biology. Now, you remember, for infection, A antibiotic may not be useful, then you have to try B antibiotic. Same thing happening in the cancer patients or the individual tumors. Some patients are very aggressive, and some cancer patients tumors are less aggressive. They are intermediate aggressive, depends upon what tumor biology. Now, one patient of ovarian cancer giving same chemotherapy which were given for other patient did not respond well. So, it went into a refractory status, that no responders. That means her tumor is very bad, with a bad tumor biology. Now, this tumor biology is not fully understood in the world. Now, they are doing the research on this. What type of tumor? Can we get some sensitive test for chemotherapy drugs point of view? That also people thinking research on that and doing the research on that. Let us see what happens, but technically right now tumor biology giving the problem, I do understand.
So you have submitted 2 research papers on breast cancer. How do you foresee this journey?
No, research has to be there. Without research you cannot proceed, because everything what we are applying in our clinical medicine is research. Can we give chemotherapy without phase 1, phase 2, phase 3 trials? No, we cannot give. So that is why research is equally important, and I still believe India should go for more and more research work. Still feel it is on the little on the lower side. I think funds is a majority problem possibly, but I think Indian brains are very good according to me. They are doing flourishing all over the world, and India should flourish, because it is flourishing all over right now also. I think in research also it will do much better. I am very positive about it.
Yeah. Indrani is here with us and asking that what are the symptoms of lymphoma?
Again depends upon the site. So if you have got a lymph node in the neck, you may not get a symptom, but you get a swelling in the neck. But if you have got a lymphoma in the tummy, sometimes if it is small lymph nodes, you may not get any symptoms. But if the lymph nodes are increasing, then you get a low grade fever every day, like a tuberculosis. Then you get sometimes pain in abdomen. If they become really large, then you get intestinal pain because they invade the intestines. So depends upon what stage you are going to diagnose. So initial stage you can diagnose in the neck, but in the tummy becomes very difficult. So according to the location of the disease, the symptoms and signs will come. But lymphoma is a very curable disease, madam. Remember that. Lymphoma is very well treatable. Attack on lymphoma and get treated and get cured.
Well, very reassuring, Indrani. And doctor, you spoke about the fact that when cancer gets detected, there is an emotional breakdown, and when the patient walks in, by the time he is almost like half down. Psychological help, professional counseling means a lot. So would you throw some light that
always I am telling you, whenever you are getting a cancer patient, never talk to them mechanically about the treatment. Now what they need is a overall understanding of the patient. See the patient as a whole, not as only cancer. That's what I would always tell to my colleagues, my juniors and everybody. So you have to treat your patient not as an oncologist only, you have to treat as a psychologist too, because you have to understand the psychology, because everybody is not strong as you as a doctor also. So you need to see that first thing, how you disclose a diagnosis, there is an art of disclosing a diagnosis. Then counsel them properly that you are going to come out of the situation. Give them aihsaas dena chahiye unko that they will come out of the disease. That is most important. That has to be done by the doctor, treating doctor, no question. And that is why we always give lot of time for first diagnosis disclosure, at least 40 minutes of counseling properly minimum, to give the patient, and not only patient to be counseled, relative needs counseling too, because they are more hyper than the patients. So they need properly this thing. But all the thing, my advice for all the patient and relative, keep patience in oncology. It is not that one day you are going to get cure from the cancer. It is a longer treatment. So have a positive mind. Negative mind has got no value. Are you going to go back out of it? No. So come out of it with such a positive way, such a positive thinking that I will kill the cancer with the treatment, and I will come out of myself as again what I was before. That should be the ideology, should work on the patient, and it should be taken up not only by oncologists, not only by doctors, not only by relatives, but all the society people should give them a positive thing. Exactly reverse happens in the society. They ask about, "Are aisa kyun hua, aisa tumko kyun hua?" No, these are the wrong questions to be asked for a cancer patient. What you ask, apart from cancer, you talk to them, give them a boost, boon in their life. Tell them, we are with you, anything happens, please tell us, we will help you out. That is how the cancer treatment works. Cancer treatment is not easy. It should be done in this particular way.
You spoke about 40 minutes talk time with the patients for counseling.
Yes.
कहीं पे ऐसा हुआ है कि 40 मिनट से भी ज़्यादा जा चुका है?
No, what we do, whenever we get a new patient and disclosure of diagnosis, we give them a separate appointment for them. straight away. So, I have never disclosed the diagnosis in 5 minutes in my 27 years of my practice, not at all, because you cannot do that. This is a breast cancer, you have to operate, go and get investigated. No, these 3 sentences will not work. You should know why it has occurred, what is the status of the disease, what is the beneficial things in this, what are odd things in this, and how you are going to treat both of them with the patient and the relative. If you do not have time, then there is no point in treating the patient. I am telling you very clearly, if I want to treat a new patient, I must have time for the patient, no question about it, and I admit that I must have time for the patient.
We always knew that doctor is the next person close to God, and the respect for the profession goes up more with what you shared right now. And with us we have Sagar, who is asking, is cancer which has an unknown source curable as well?
Yeah, there are certain cancer signs they come when you cannot find the primary, especially happens in the neck. You get a lymph node and which is squamous carcinoma after the test, but we cannot find anywhere primary in the neck. So, what we do after the PET scan, everything, triple endoscopy, then we remove the tumor with the radical neck dissection, give radiation therapy and chemotherapy together and keep them under surveillance. Sometimes you may find primary after 2 years also in head and neck point of view, but there are certain cases you may not find primary, and if the metastasis which is occurring, which is very huge number, then becomes very difficult. If it is a solitary, if it is very less, yes, you can able to treat it, but if it is coming in a vengeance, then it becomes very difficult to treat.
Okay. Yes, so therefore we have another question with us which is asking, what are the different ways of treating advanced cancer? And maybe if you can pick up one or two cases.
Always remember, we are treating all good cases, no question about it. There are certain advanced cancer where treatment is stopped and we tell them further treatment is not possible. Now, these are called as advanced cancer patients. Now, what is to be done for this? Very important things I would like to highlight on this. Now, this, suppose oral cancer advanced, it is not possible to do any treatment. What are you going to do with this patient? They are going to live for 1.5 years also. So, are you going to leave them on the road? Are you going to drive them out? No, not at all. They have got symptoms of pain, they have got symptoms of problems of nutrition, they have got problems of emotional support. All these things could be given, and what is called as hospices which are available. Unfortunately, we have got a very less hospices in India, finger counting 3 hospices in India, one is Mumbai, Delhi and Goa. Now, these hospices, I think Mumbai has got a Shanti Avidan Ashram founded by Dr. L.J. D'Souza, one of the greatest cancer surgeon of Mumbai, and he formed that in 1985. It is 100-bedded hospice. Now, what they take care is care of pain, how you can reduce the pain, how you can maintain the nutrition, and what best emotional support you can give. That is why this is called as palliative care in advanced patients. And there is very nice say on this. There is no limit to do cure for any patient, but there is limited thing for cure for patient, but there is no limit to take care of anybody. I think that is most important. You should understand there has to be impact. We should have affection for such patients. Even if they are advanced, you should give them as much fair quality, keep them pain free as much as possible. I think the all attitude toward all stages of cancer has to be different, has to be affectionate, has to be from the heart of the doctors as well as from the society.
Well, Meghna has another question for us is if someone has ovarian cancer detected at stage 3 alongside BRCA1 mutation, what are the chances of survival?
Again the same, it is a basically hereditary cancer, strong hereditary cancer, as a BRCA1 mutation is positive. Now, the addition of BRCA1 to know is that there is what is called as drug olaparib, which has come in the picture, which can be given for BRCA1 patients as a maintenance in a stage 3 patient, but it does not change the survival because stage 3, stage 4 patient has got a limited survival. You can prolong as much as possible, you can increase disease free survival, but cure remains a problem in such patients.
So, even if a stage 3 cancer gets cured, what are the chances of not relapsing again?
No, stage 3 cancers get controlled, they do not get cured, because cure means what? Once you treat the cancer, it does not come back, that is called as cure.
So, the question still remains.
Correct.
The chances of relapsing.
Chances of relapse, it comes in a higher stage of disease. Stage 1 breast cancer will not relapse very easily. But stage 3, any cancer will relapse quite early. There are anecdotal cases you may get stage 3 patients who are surviving for 7 years without a recurrence, but not very common. Commonly they recur within some period of time.
Interesting. Okay. वेरी नेचुरल एंड ऑब्वियस क्वेश्चन, हालांकि आपने इसके बारे में काफ़ी हद तक बात कर भी चुके हैं कि अगर कैंसर डिटेक्ट होते हैं तो उसके साथ जुड़े हुए जितने खर्चे हैं, व्हाट कुड बी एन इंडिकेटिव कॉस्ट अराउंड इट, बट वी वुड रियली वांट यू टू टॉक अ लिटिल मोर बिकॉज we are generally never prepared about any critical illness in our life.
Correct. I think this is also equally important question. I feel we have got methods of treatment, algorithm is available, but what about affordability of the patient? That is more important. Whether they will afford this treatment or not. Sometimes they require surgery, chemotherapy, radiation and hormone. It goes on for 7-8 months. Now what is to be done? So we have to find out the venues of the treatment. Some people may afford, some people may not afford. Some people partially afford, they require some sort of partial support. Now that is why the awareness of, again, what you have got a medical insurances now which are coming up, that should take the advantage of this. Whosoever can afford, take the advantage, because our mediclaim is around 10% if I am not mistaken in India. It should be more if they can afford. Save the things. Mediclaim, I always feel, is one of the savings what you can do. If you can afford, you can do it. But at the same time, cost has to come down for treatment. I do agree with the government, no question about it. But at the same time, you can take the advantage of these insurances and you can be well treated with that also, number one. Number two, if patient doesn't afford insurances also, if that the thing, there are trusts which are available, there are certain NGOs which are available who can give them some funds. There are certain donors which are interested to treat cancer patients whom himself they are cancer patients. There is only thing you need to know how to go about and reach these people. And certain poor people, I have got a lot of sympathy for them. They don't able to reach these all options, and they don't know where to go, where to approach. They can't even ask. And I think such patients need to be find out and give them a help whatever is possible. No question about it. But cost factor is definitely there. I think need to be addressed. Overall drug cost is also getting less. Now they have put some drugs in DPCO also. So majority cost has, some drugs have definitely come down. Trastuzumab like thing in breast cancer has definitely come down. I do agree on that, but still the things are improving. Government and everything, they are taking interest to do that. Majority thing they are developing in the government hospitals also nowadays. So later on the cost will become reasonable, but point of a time, cost, yes, cost is some constraint because cancer requires some cost to treat, no question about it, because it's a long treatment.
Absolutely. So there are many avenues. All that we need to do is find out the right one which
Correct.
suits us. That takes us to the next question coming from Vandita. How do cancer drugs work?
See, this is a chemotherapy mechanism. They normally act on the microscopic way, that is DNA, RNA and all these things. I don't go in the details, becomes very difficult and too scientific on this forum, but they work on the molecular level basically, and they kill that particular thing, that RNA DNA cycle. So that is called as how we treat the antibiotics like a bactericidal and bacteriostatic. The same way the chemotherapy drugs act. So they, when you give chemotherapy, it doesn't act only locally, it goes all over the body and it does cancer cell kill. So that is why there are certain cycles are designed, which we know that after 6 cycles there is a maximum cancer cell kill in the body. People ask us, doctor, why 6 cycles, why not to finish in 2 cycles? So there is a study for years together that 6 cycle will do the maximum cell killing in the body and it will try to keep you disease free. 2 cycles are not sufficient enough. So these people should know about it, and always remember, if the chemotherapy advices, please take it with a positive mind, because it is going to add to your cure and add to your benefit in the future. They are not going to have long term effects. Mind well, I am telling you, please remember this. Please don't have myths about the chemotherapy, please, please.
Thank you, doctor, for those reassuring words. How important is it to have a critical insurance in today's day, considering that critical illness comes as a surprise without knocking the door?
Yes, there are different insurances available. Whosoever can afford that option must take it, because they are going to help in your own treatment. Because cancer is not a 1-year thing. If it is a stage 3 detection, it will come in next year also. Suppose there is a recurrence, then you have to spend again. So all these insurance things will going to help you in future. If you can afford to take this option, nothing like it, go ahead and take it.
Absolutely, because death happens once. but you know, living death, it probably kills us every day, financially,
Correct.
emotionally, mentally. And who said in India insurance is not actually bought and sold? These are actually the time that we should go for a self-introspection and make a proper planning around it. That takes us almost to the second last question of the day, which is what are the stages of cancer and what do they mean? It comes
Now,
from Vivek.
there are 4 stages of cancer, which we divide stage 1, stage 2 at one side compartment, and stage 3, stage 4 from other compartment. Stage 1, stage 2, they are early detection, they are well curable, more than 95% curable. Stage 3, as I told you, 25% can be cured with aggressive line of management. Remaining 75 and stage 4 disease requires a good therapy as a control as well as palliation treatment. So, our aim should be focused on first compartment to detect stage disease, at least not stage 1, at least stage 2. At least start putting in the stage 2 as far as alertness and everything goes, and get cancer treated and cured, rather than waiting for some time with ignorance, going into stage 3 and getting death towards you. Why to do that? So, be alert, and as I told you, in cancer, if you want to avoid something, you should try to have something good in the life. So, that is why have nice habits in the life, have a nice stress-free lifestyle in the life, be away from all poisonous substances, have a nice exercise, have a good yoga meditation, and have a nice thoughts in the mind, and be positive about all the things. See, the diseases will go away from you.
And the last question for the day is what are your suggestions for preventive measures?
That's what I told the same way.
Being the last
So,
question,
yeah.
let's kind of make the
So
viewers
this
walk
is how
through it
you
again.
prevent. People always say prevention is better than cure, and it is very true for cancer. Why you want to have cancer and treat? So how can you prevent? With lifestyle and with the bad habits prevention, we can prevent more than 50% of cancers with tobacco and everything. So be away from the bad habits, be away from the tobacco, alcohol, food adultery substances, poisonous foods and everything, away from the fast food, away from the fatty foods. Have a nice lifestyle. And I am telling you, life is so good, but you must know how to love your body and the life. Don't run after the career all the time. Career is equally important, but you need to say what is to be done and what is not to be done. Do's and don'ts you must know. And I always say, have a nice lifestyle, have a looking at towards life, जो अपना दृष्टिकोण है वो बदल डालो, be positive in the life, always see life is very beautiful in front of you. Thank you.
My takeaway from the discussion are 3L: live, love, life. If you want the rainbow, you have to put up with the rain as well. On that note, thank you so much, Doctor. It was indeed a pleasure having you with all of us. And I take the pledge today on the World Cancer Day, I am and I will. And I do hope that you will equally take this pledge and work proactively towards it. Thank you so much and wishing you a pleasant evening.
Thank you very much.